Hello. Hello there. I'm just swimming. Okay, never mind. Welcome. Welcome to Chapter 19, Small Animal Medical Nursing. And we're coming to you live from inside an aorta. And we'll talk more about this later. All right. All right. Well, of course, small animal medical nursing, it may seem strange. Here it is, the last month of your program, and we're just now talking about small animal medical nursing. But really, we've been talking about it from the first day that you walked in the doors. Medical nursing, whether it's small animal or large animal, it's all about a good physical exam, obtaining a good history, using clinical lab skills, your knowledge of anatomy and physiology, pharmacology, kind of bringing it all together, as well as other therapies that we can use. And we'll talk about some of the respiratory and cardiovascular therapies today. Sadly, these are things we would have done face to face. So I encourage you to get a stuffed animal and practice coupage and thoracocentesis on them. So, but I'm getting ahead of myself. The chapter is great. I like the beginning. It reviews the the veterinary technician practice model, how to make practices be vet tech centered, and that cycle. It really provides excellent patient care. It's evidence based, but we're not going to talk about that here. So do read it, but we're going to leap right into respiratory and cardiovascular disease. The two are grouped together. Hello. Okay. The two are grouped together because they have similar signs sometimes, and just when you think there's nothing new, things like this come along, where grain-free diets may be linked to some heart diseases, to dilated cardiomyopathy, and we'll talk a little more about that later. Both respiratory and cardiovascular disease can lead to low oxygen levels. And of course, I think you know by now which two organs are the most vulnerable, the heart and the brain. Any organ can suffer, but those two, the repercussions would be the most serious. And using our knowledge of small animal medicine, we can take patients from this, a patient who is hypoxic, struggling to breathe, extremely stressed out. We can take them from this to this. I don't mean we're going to turn a cat into a bulldog, but maybe I should have had a video of a happy cat in hindsight. But the point is, I had a patient who was a bulldog who looked like that cat, and now he looked like this. That was like 8 years ago. But we can do this. We can turn them from scary to, hey, happy. Maybe not forever, but for at least a little while. We can buy them some quality time. Now, obviously, you don't have the quiz thingy, but what I would have you do is you can go to Canvas and get, oh, that's kind of weird. You can go onto Canvas and find the study notes and go through the 10 questions. And then what I'll do is I'll post those questions and I'll highlight the answers so you can check your own answers. But you can go ahead and pause and check the 10 questions here. Okay. Now the study notes are a little different. The lesson was supposed to be in the form of a case study. And so I thought, well, I'll just keep it that way even though it's a little different. But I think it's okay if we leave it that way. Our goals today are going to describe some of the general clinical signs and general treatments that we associate with respiratory disease, and we're going to include congestive heart failure with that. We'll compare and contrast causes of congestive heart failure, looking at myocardial and valvular diseases in dogs and cats, and we'll compare and contrast heartworm disease in dogs versus cats. It's a very different disease in cats. And then we'll describe the mechanisms of action of some common cardiovascular medications: furosemide, pemobendin, ACE inhibitors, and amlodipine. Now, the ACE inhibitors, that one we're going to take a little bit of time on the ACE inhibitors, just because I think it'll help you understand a very important concept in how the kidney and the heart don't always have the same agenda. And you'll hear this expression: what's good for the heart is bad for the kidneys, and what's good for the kidneys is bad for the heart. But we'll come to that later. So just as a quick overview, talking about the respiratory system, in particular, we're going to be talking about not so much about the trachea. We'll be more interested in the bronchi and how it's going to branch off into smaller bronchi and then smaller and smaller bronchioles until eventually we reach the alveoli. And again, this just shows you that same thing. And the reason I included this was to show you what's this red ribbon? What's this red ribbon around the bronchioles? It's found in bronchi 2. What do you think that is? That's smooth muscle. Smooth muscle. That's the kind of muscle we find in your bladder, in your esophagus. We find it in arterioles and arteries. We find it in bronchioles. Smooth muscle can contract just like any other muscle, and when it's in bronchioles or arterioles, it's going to either get more narrow or it's going to dilate, right? So it's going to constrict or it's going to dilate. Just remember that. We can learn a lot from history and clinical signs. Owners will often come in because their pet has a cough, and I think we've talked before about productive versus non-productive coughs. I'm not going to show you this video. You've seen it before last year in physiology, but it's from the TV show The Doctors, and it gives examples of non-productive coughs versus productive coughs. Non-productive coughs we associate with the larynx and the trachea, possibly the bronchi. It's a dry cough. A productive cough is producing mucus, and it's very hard for me to imitate that. It sounds a little bit like a smoker's cough. If you've heard smoker's cough, it kind of has a rattling cough. That's what a productive cough would sound like. Sometimes it's more moist, and sometimes it's kind of a soft cough, but the dog or cat or horse is trying to get stuff up. As my grandmother would say, I'm coughing up some awful corruption. She had a smoker's cough. But she quit smoking and she lived to 93. So God bless her. Corinne McMahon. Okay, other lung sounds we've talked about in the past are wheezes. Wheezes we associate with narrowed bronchi. You can see that here. Again, it's where the smooth muscle is constricting. That can happen from allergic bronchitis. Kennel cough can lead to inflammation of the trachea and the bronchi. Sometimes bronchitis is idiopathic. And then you'll see later in heartworm disease in cats, it causes bronchitis. It doesn't cause heart problems. And again, these are two videos we've watched before. So we watched them a year ago in physiology. And I'll just encourage you to go look at the PowerPoint and watch these if you'd like to see them again. So I want to show you an x-ray of a normal cat compared to a cat with bronchitis. I'll zoom in a little closer, but the cat is laying on his side. So his head is over here. There's his trachea. There's his heart and aorta. And then you can see these are bronchi, and you're actually seeing blood vessels here too. Actually, I'm sorry, those are not bronchi. Those are blood vessels. The white things are. And then this kind of, cobwebby sort of appearance. You're seeing, airways and just the connective tissue of the lung. Now this cat has bronchitis, and you may not appreciate the difference immediately. So let's actually put them side by side here. So if you look real closely at the cat with bronchitis, and again, it's not super clear, but if you look really closely, there are just little donuts everywhere. Again, I'm trying to draw little circles around them. These are kind of where they overlap with this. If you could see this in person, it wouldn't be quite so blurry, but there's just lots and lots of little donuts. And what these are the, the bronchi coming right at you. And so the x-ray is getting a cross section. You'll see little, where the bronchi is coming towards the x-ray, you get these little circles. And if the bronchi were sideways, you get what are called tram lines or train lines. Again, it loses some detail when I highlight it. And I realize if you look over on the normal one, you can kind of imagine some too, but it's really very striking if you look at the if you could look at the actual x-ray. So that was talking about wheezes, and then of course down in the alveoli, if we get fluid building up, if we get infection, we get crackles, and it has sort of this snap, crackle, pop sound. And you may recall we showed you this. Sorry, what? We showed you this little video clip of a cow this cow has pneumonia. And so if you could hear her lungs, they would probably sound horrible, and they'd probably sound full of crackles. So it's horrible. And again, video clip from last year. Actually, it's more of an audio clip, so you can listen to that. And just showing you the alveoli. And another lung sound, maybe the worst lung sound of all, would be muffled lung sounds or silence. This little cat has fluid building up outside the lung. And so if you were to put your stethoscope right here, you wouldn't hear anything. And this is to show you pleural effusion. So again, here's a normal cat on the left, and on the right, all this up here, that's pleural effusion up there. All right, so this is all fluid outside the lungs, and the lungs you can just see the lungs are kind of swimming. They have this kind of scalloped edge here that's not the sharp point because there's fluid surrounding the lungs here. And that can happen from feline infectious peritonitis. It can happen from clotting disorder, trauma, some sort of obstruction. It can even happen, some sources say, in cats with congestive heart failure. And you'll see these cats struggling to breathe. We call that dyspnea. There's a particular stance called orthopnea, I'll show you a picture of. Lung sounds can be decreased or absent, and of course, there's a lot more effort for them to breathe. Orthopnea refers to this position where they often have their elbows, abducted. They'll often have their necks extended. They're just trying to do everything they can to improve airflow down their trachea and bronchi. And so if you see these animals with their elbows out, that tells you that these patients are struggling to breathe. So now let's talk about some of these general treatments. Grab your stuffed animal or your baby brother or whoever you have around, your dad, and you can practice some of this on them. Okay, so, but one thing to keep in mind, when the patient comes in looking like this guy over here, right? So this patient comes in, it's very tempting to say, get an x-ray, but just remember, x-rays are not therapeutic, all right? So you may not want to do the x-ray on this guy. These dogs and cats they are on the verge of going into cardiopulmonary arrest. Pulmonary arrest or cardiopulmonary arrest, something bad is about to happen. And if you stress them out by putting them on the x-ray table, they may decompensate right in front of you, and now you have a dead cat. So do something else instead. Oxygen is a good idea. Remember, it is flammable, so just keep that in mind. But there's different ways that you can rig giving oxygen. Some patients will allow a mask, but some don't. So a little cellophane and an e-collar can help. Sometimes we put them in a cage and surround it with a garbage bag and put oxygen in it. There are actual oxygen cages that are really cool. This is a little, just a red rubber tube that has just been surgically stapled and going up to his nose. That may supply enough. I didn't mention this here, but we actually give some of these patients sedatives. They are in panic mode because they cannot breathe, and a sedative may not hurt. It just may relax them a little bit. Two other procedures we use are thoracocentesis and coupage. And what I'm going to do is just show you this little video clip and then a video of thoracocentesis. So this refers to drawing fluid out of the thorax, just like cystocentesis is getting fluid out of the bladder. This is both diagnostic and therapeutic. The fluid you get out can help you tell, well, is the cat or dog bleeding into their abdomen? Is it some sort of trauma? Is it a chylous effusion like we'd see with feline infectious peritonitis? So we can learn a lot from it. If we get air out, right, that would tell us it's a pneumothorax. So and we can use it to actually help the patients. And we can and then maybe if after we do this, then maybe we could take an X-ray. It's done at the 7th and 8th intercostal space. That way, it's not so close to the heart. Typically, you're less likely to accidentally poke the heart, but it's still, you'll still get a good sample usually. Even better is to use ultrasound on the dog or cat's chest and look for fluid. And you'll see that in a video in just a second. This doesn't really show, this just shows they've clipped the spot. There's a 22 gauge needle or a butterfly catheter and extension tubing. I really thought that was a little video, but no. And they're using what's called a three-way stopcock. And you'd want to save any samples you got. You can often put it in a, if you want to do analysis, you can use a lavender top tube. For culture, you'd use a plain top tube, or you could use a culturette. The book mentions a three-way stopcock, and I don't think we ever really had a chance to play around with these. They're very cool. As you adjust this little stopcock here, you can redirect the flow of fluid. The reason that's important is if you don't have a three-way stopcock, you have to suck this fluid out, disconnect it, squirt the fluid out, reconnect the syringe, suck more fluid, disconnect, squirt. It just gets, it increases the risk of contamination. It takes longer. You'll see with the with this video that the three-way stopcock allows you to do all that just by turning this little blue dial here. And so as you watch this video, imagine that the blue line is coming from the needle in your patient, right? Just imagine the blue line coming from the actual patient. I'm just being paranoid here.
Hi, I'm Megan. Today we're going to learn how to use a three-way stopcock. Three-way stopcock is a tool that's going to allow you to draw fluid or air from a cavity using a closed collection system. So this is important, especially if you are in the chest cavity and you want to draw back your fluid or air, and you don't want to have to disconnect your syringe from the needle every time you need to empty it. So with a three-way stopcock, you need to remember that where this little vial is pointing, that's closed. So right now, we are closed off to the blue line. So if I draw back, I'm drawing from the red because this is the open port. I can also push back on that on the red side. If I close off to the red and I draw back, I'm going to get the blue. So in both directions, pushing and pulling, I'm using the blue. So what if I want to put blue into the red line? I'm going to be off to the red. I'm going to fill my syringe with blue. Then I'm going to turn this off to the blue. And when I push, I have now filled the red line with blue. If I want to go the other direction, we're going to make purple. Now I'm going to turn, well, I'll probably need to fill this. I'm going to turn off to the red. And now we've made purple. And that's how you use a three-way stopcock.
So that's Megan Brashear, formerly at Dove Lewis in Portland, and now she's on the faculty at Purdue University. And that's a great little video. If we don't want to make purple. So I don't know why she just didn't say, pretend this is a dog or a cat. But anyway, just as you saw the blue, you just imagine the blue would be pulling, you know, blood or some effusion out of a dog or cat. Right, the very, very cool three-way stopcock. Now we're actually going to watch a thoracocentesis done. It goes kind of fast, so you can stop and rewind it. I realize that these Zoom lectures, they make the videos kind of choppy. So of course you can always go and watch this directly from the PowerPoint. Hold on Why did that? That didn't work. Hold on.
Little Red Riding Hood. Let's start the story a different way. It was dark inside the wolf.
In today's Vet Girl video, we're going to demonstrate how to do a thoracocentesis. Whenever you see a dyspneic cat, we always want to have the cat in flow by. We want you to be able to feel comfortable performing a thoracocentesis because it's a life-saving diagnostic and therapeutic procedure. If you have an ultrasound, we want you to be able to do a fast ultrasound to look for that presence of that large black hypoechoic pocket. Here, you can see we're using the fast ultrasound to identify the best location. You want to use sterile technique, a three-way stopcock set up with a butterfly catheter and syringe. And we typically want to go in the 7th to 9th intercostal space, ideally cranial to the rib to avoid the vessels and the nerves, and evacuating as much pleural effusion as we can to make the cat comfortable. Here on repeat fast, you can see there's still a significant amount of pleural effusion. And here we're actually saving the pleural effusion because it was quite hemorrhagic in sterile 60 ml syringes in the event that we need to auto-transfuse it. On repeat fast ultrasound, we can see there's a dramatic improvement in the reduction of pleural effusion. And again, if you don't have a fast ultrasound, still go ahead and do a thoracocentesis. Again, can be life-saving in that dyspneic cat. Most of the time, we don't actually sedate cats for this because they seem to tolerate it relatively well. Clinically, you can see that this cat is dramatically improved. It's breathing much more comfortably and is no longer breathing with a short, shallow breathing pattern. And with that, hopefully you feel comfortable performing a thoracocentesis. In today's Vet Girl video, we're going to demonstrate how to do.
And there were two concepts you may not recognize. One was you said flow by. That's referring to the allowing the flow by of oxygen. And then the other one was auto transfuse. Something we didn't talk about is you can actually take a patient's own blood and transfuse it back into them. That's kind of cool. Okay, so that's one therapy. That's RVTs can and should be doing. And then another therapy is called coupage. And in this video, you're going to see the RVT using a nebulizer. So a nebulizer, in this case, it's a saline nebulizer. So it's just going to kind of moisturize the oxygen with saline, and that's going to help this dog break up, basically mucus and maybe purulent material down in his bronchi and bronchioles. And then she's going to use coupage to help break up that garbage. And I'll just let her explain it.
Hi, I'm Joni. I'm one of the technicians here at Dove Lewis. Today we're going to nebulize and coupage this patient with aspiration pneumonia. This is my little nebulization unit that I have pre-filled with saline. This patient doesn't need any additional medications with his nebulization. We are just using saline and oxygen to run through so that he can stay on oxygen while he's receiving his treatment since he is oxygen dependent. Once the air runs through the saline, it's going to come out the nozzle in a fine mist. He'll inhale that and it will thin out the secretions in his lungs and make it more likely for him to be able to get those out. The nebulization is just the first part. Once those secretions are thinned out, then we perform coupage, which is a firm percussion on his chest to help loosen up those secretions and help him cough those out. So we try to keep the patient as sternal as possible, keep them in a comfortable position while we nebulize them. We want them to breathe in this mist for about 5 to 10 minutes, help thin out as much of those secretions as we can, and give them the best opportunity to get out. So it's now been about 10 minutes. So we are going to switch to coupage. Coupage is named because of the cup that your hand makes when you percuss on their chest. You want to have them as sternal as you can possibly get, and you want to do it evenly on both sides. You're going to make a nice cup with your hands. You're going to make some percussion on each side pretty firmly. You want to get vibration in there. That is what's going to break up the mucus and help him be able to cough it out. So I usually try to get the whole of their chest, but I will try to do forward motions with it, start from the back and go forward to try and help him expel it out. So that's how we do nebulization and coupage here at Dove Lewis. Hi, I'm Joni. I'm one of the technicians here at Dove.
Yeah, and coupage is something that you can, you can teach clients how to do also.
This patient doesn't need
Hello, how do I get out of here? I hope you were able to see that. I can never quite tell. Sorry, everyone. Okay, hi. Let's just go over here again. Okay. But you can teach owners how to do coupage at home and, oh no, okay, here we go. Okay, so again, if you would like, you can pause and look at the notes and take 5 minutes to answer questions about Killer. I'm just gonna read this to you. He's a 9-year-old male neuter domestic shorthair. The chief presenting complaint is vomiting, and he vomits up a small amount of foam and bile several times a day. So you can answer these questions here, and you're not supposed to know the answers. Just start thinking about, what do you already know? You already do know a lot about these things. So some of them, like some of these questions, until I show you the picture, you won't know. But just take a few minutes, think about these questions, and then we'll resume. Okay, you done? Let's go. Well, Killer is actually not vomiting. He's actually coughing. So I'm going to show you 2 cats here, and you tell me which one is coughing, which one is vomiting, and how can you tell? So here's cat number 1 in slow motion. Okay, is that a cough or is that a vomit? Now look at this guy. And you'll notice nothing came up with either one. Nothing came up with either one. So you can watch those again. You may have figured it out. This guy is going to vomit, and this guy is going to cough. Maybe you can just tell that, but there's actually some other things that you are using to make that decision. So one is, you'll notice this guy, there was a lot more abdominal effort. It's kind of this pumping motion with his abdomen. And if you could see him, you might notice that he's smacking his lips. He might be drooling a little bit. And of course, bile or food would come up or fly out. When cats are coughing, on the other hand, they tend to kind of squat down like he is. You see, he's kind of squatted down like that, and there's not a lot of abdominal movement. Instead, it's the abdomen and the chest are both working together as he's in this kind of squatted down position, and his head, goes out each time. The other clue is that foam is coming up. Foam would not typically come up when they vomit. This, however, should be mentioned that some cats will cough so much that they make themselves vomit, right? They will cough so much that they will make themselves vomit. And so it can sometimes be very hard. The owner will come in and they'll bring you the cat's vomit, but is the cat vomiting or coughing? It's a good idea to ask owners to get a video. It's so helpful because sometimes they bring the cat in and, you know, the cat's not coughing or vomiting. So if possible, remind owners or suggest owners to try to get a video when they come in. And we're going to come back to that. So this guy Killer is actually coughing. He actually has he has cardiovascular disease. So we're going to talk about that. We can consider most, not all, but a lot of cases of cardiovascular disease involve either the myocardium or the valves. So the myocardium, right? That refers, oops, gosh darn it. Sorry. Okay. So the myocardium refers to the muscle layer, this thick layer all throughout here, right? That's the myocardium. And in cats, most of their diseases are myocardial. Either most common would be hypertrophic, but we can also have dilated cardiomyopathy. And I'll show you that in a moment. We do see dilated cardiomyopathy in dogs too. Either way, these myocardial diseases can be primary. You can have Maine Coon cats. That's these really giant cats. They have a genetic predisposition to forming this disease. Dogs like Dobermans and Boxers and Great Danes, they're at risk genetically for developing this dilated cardiomyopathy. And then, but the problem can be secondary as well. So you'll get cats that are hyperthyroid, and the hyperthyroidism will cause the left ventricle to hypertrophy. You'll also get dilated cardiomyopathy in dogs that survive parvo. And then, as we saw earlier, there seems to be a link between grain-free diets and dilated cardiomyopathy because of taurine, which has a very interesting history. If you get a chance, look up taurine. Anyway, it's interesting because we've basically allowed history to repeat itself with these grain-free diets. But okay, this just shows you hypertrophy of the cardio. Let me just back up here. Right, so here's gosh darn it. Right, so this is the heart. There's the left ventricle of the heart, and you can see it's getting big and beefy. That's called hypertrophy, and it's not good because now there's a lot less room in this heart. In fact, here's that left ventricle, a cross section. There is no space, no room for blood in that heart, so it's not good for the cat. And then the video zooms in on the individual cardiac muscle fibers, and you can see them bulking up, and then scar tissue fibrosis develops, and it loses some of its elasticity. I don't know what that last part is all about. It's just showing you the two hearts. So, so that condition can be primary, meaning genetic in that gigantic Maine Coon over there, or this other cat over here, is hyperthyroid, and all that excess thyroid hormone causes the heart to bulk up. And here's what hypertrophic cardiomyopathy can look like on an X-ray. So here's a normal cat on its side, right? There's the heart. And here's a cat with hypertrophic cardiomyopathy. That's right, the heart looks the same. That's because the heart's not getting bigger on the outside, the heart's getting bigger on the inside. And so x-rays will not diagnose hypertrophic cardiomyopathy. An ultrasound will, and I'll show you that a little later. This is that other condition where instead of a thickened left ventricle, now we have a thin and floppy left ventricle. And again, this can be inherited in boxers and Great Danes. It can also develop. This is what the grain-free diet appears to have been causing in some dogs. And it even used to be a problem back in the 70s. Cats used to get this disease, and then they discovered this amino acid that I think is not an essential amino acid in humans, but it is an essential amino acid in cats and apparently dogs. And again, just to show you what dilated cardiomyopathy would look like, here's a normal heart. Oh, here we go. This is better. Here's a normal dog heart. And now I'll put it side by side with a heart with dilated cardiomyopathy. So you can appreciate it's just all stretched out and big and floppy. And that's not good either. It's got plenty of room, but that cardiac muscle can't contract very well because it's been thinned out. That's myocardial disease, and again, mostly in cats, you're mostly going to see hypertrophic cardiomyopathy. Dogs, you'll mostly see valvular disease, and so by valvular, we're referring to one of these guys, right? My gosh, what is wrong with me? Right, so you've got the various valves. You've got valves between the atria and the ventricles. On the right side, it's the tricuspid valve. On the left side, it's the mitral valve. And those valves in particular are the ones that can start to fail. They don't close and make a nice tight seal. They prolapse. When they close, they go backwards a little bit. And I'll show you a clip that just allows blood to backwash from the left ventricle, for example, back into the left atrium. And that's bad. It's going to cause fluid to build up. But you can also develop problems with these other valves, the aortic valve and the pulmonic valve, but we're not going to talk about that today. Let me just, oh, that's fine. That actually shows you that. So again, just to show you the movement, that shows you all the valves. And then this little video it just shows you as blood moves from chamber to chamber, these valves close and other valves open to allow this one-way flow of blood. And then what can happen over time is that these valves become thickened and they don't close. And just keep your eye, that's the mitral valve. You're going to see it about to break, and then you'll see what happens. You'll see blood starts going the wrong direction. And there's one breed, and we usually see this in older small breed dogs, but I wanted to mention the King Charles Cavalier Spaniel. That's a small breed dog that valvular problems can develop when they're still young. And so if you're not familiar with them, very sweet dogs, very cute dogs. Just be aware that you may not want to tell the owner this. Hopefully they know. But these guys, they may start to develop heart disease even when they're only middle-aged and not old. And I thought it'd just be good for you just to kind of hear, again, we've heard this before, but this is what, instead of lub-dub, 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 the lub is when the mitral and the tricuspid valve close, and the dub is when the aortic and the pulmonic valve close. And so there should be silence in between them. Lub, dub, right? There's silence. When you've got problems with the mitral valve or the tricuspid valve, instead of lub dub, there's going to be lub stub, lub stub. That sh is the sound of blood squirting backwards at a high speed. And what it really was going to sound like, you're not even going to hear the lub and the dub. You're just going to hear the sh. So shh and listen. I just cracked myself up. All right, do you hear that? Remember S1, get out of here. S1 is the lub and S2 is the dub. And so, but if you listen real closely, you can still kind of hear them. And it would sound the same. If this were the tricuspid valve, it would be the same sound. Shh, shh, shh. How could you tell whether it's mitral valve or tricuspid valve? Well, what side is it loudest on? If it's loudest on the left side of the dog, or well, dog probably, then it's going to be the mitral valve. If it's loudest on the right-hand side, it's going to be the tricuspid valve. And you can remember all those. Oh my gosh, this is so annoying. You can remember. There you go. Those little tricks we learned, like, well, how do you remember the tricuspid valve is on the right and the mitral valve is on the left? You can remember that the mitral valve is also called the bicuspid valve, and you want to try before you buy. That's one way to remember. Or the mitral valve is a mighty valve because there's so much more pressure generated on the left side. Okay, but let's go back to our friend Killer. So we're going to do an ultrasound of his heart, what's called an echocardiogram, and this is an echo of a normal heart. And in a moment, you'll see some color, and that's color is just it kind of reflects the direction of blood flow. Oops. So yeah, what you're seeing here, this is his, this is probably, well, it's a little hard to say. This is one chamber of the heart, and then this is another chamber of a heart. Maybe this is, well, you'll see. Remember, the heart is not, it's a little hard to do a cross section of a heart, but you're seeing there's the myocardium right there, right? Okay, now let's look at Killer's heart. Okay, you see now we've got this crazy thick myocardium with a very small lumen. Everything also looks kind of stiff too. Those are valves. What you're seeing there are, those are valves, and his valves are probably okay. And again, this is, now we're looking at his heart from another angle. Again, you can just see how thick that wall of the left ventricle is. Okay. So Killer is actually in congestive heart failure. I know I have a dog here, but Killer's heart just can't pump very well because not enough blood can fill up that left ventricle. So a traffic jam is forming in Killer's lungs, and that's why Killer is coughing. So there's a medicine we can use called furosemide, and we're going to talk about that. But let's first describe some of the long-term effects that these different diseases can have. because that's going to help us a little bit later. All of these disorders that we've just learned about can result in congestive heart failure, right? Where fluid is going to build up into the lungs. And even in cats, it can build up outside the lungs and cause that pleural effusion that we talked about. The heart and the kidneys are going to try to deal with this. In the short term, it's okay. You'll see in the long term, problems will develop. In the short term, because for any of these diseases, cardiac output will be reduced. And we'll talk more about cardiac output in a moment, but you may recall it's how much blood the left ventricle can pump per minute. And I mean, basically it's how much blood the heart pumps per minute. And if that goes down, then hypotension develops, and the body does not like hypotension, especially the kidneys. The kidneys hate hypotension. And so things will happen to try to increase the blood pressure. One way is that the heart will increase its heart rate, and then the kidneys have ways of increasing blood pressure that we'll talk about in a little bit. Patients may come in with a heart murmur, but not heart disease. And so we often want to teach owners how to monitor for progression of disease. Or they may have signs, but the signs can get worse. So there are certain skills that we want to watch for and things we can teach owners. And a really useful skill to teach owners is called the resting respiratory rate. And so patients that have heart failure, they may seem okay. A really sensitive indicator is how many breaths per minute do they take when they're asleep? In general, they should take less than 30 breaths a minute. This dog, how many breaths per minute is he taking? I don't have my watch on me, but that looks like it's more than 30 breaths a minute. I mean, it almost looks like he's panting, but this dog is asleep. So this dog probably needs to be put on heart medications, or maybe if he's on heart medications, the doses need to be adjusted or increased. So the problem over time is that the heart and the kidneys can try to make things better, but over time, these mechanisms start to fail. The heart can only beat so fast, for example. Eventually, hypotension returns. With that, we get our big boogeyman hypoperfusion, right? That's where I left the I off. That's where tissues are not getting the nutrients they need. They're not getting the blood they need. And then we get shock, right? That's what shock is all about: tissue starvation, tissues starving for oxygen. This kind of shock we call cardiogenic shock, just because the cause is the heart, not dehydration, not blood loss. And with left-sided heart failure, you'll see patients with a rapid respiratory rate. They may collapse. That's syncope. They're weak. Their CRT's prolonged. They've got pale mucous membranes. Dogs will not want to run and play. Cats will often lose weight because they're not eating. Dogs too sometimes. So these are all symptoms we see. In dogs, we often use ACE inhibitors, and a drug called pimabendin, which is an enodilator, and we'll talk a little more about what that means. We use diuretics, a low sodium diet. We're going to talk more about those a little bit later, in particular ACE inhibitors and pimabendin. But for killer, let's talk about furosemide and a totally different drug called Plavix. The book mentions medicines to stop blood clots. It doesn't mention Plavix by name, but Plavix is what it's referring to. So diuretics are used to promote the loss of water. These patients have water basically building up in their lungs, and we want to get rid of it. Also, that it sounds crazy, but it actually dehydrates the patient a little bit, but that's okay. That actually decreases the workload on a failing heart. Maybe I shouldn't say it dehydrates them a little bit. We don't want them dehydrated, but it does decrease how much fluid is in their bloodstream, and that will decrease the workload on the heart. The loop diuretics, there's really just one loop diuretic, and that's furosemide. The loop refers to the nephron and this thing called the loop of Henle. And we've got the glomerulus here. So this is where glomerular filtrate begins, and eventually this fluid will be modified until it is turned into urine and goes down these collecting ducts. So furosemide works by inhibiting the reabsorption of sodium. This little video here, I think that's actually supposed to be a water molecule. I'm not even sure what that is. This is actually not a great clip because that's showing the collecting duct. So I don't think I realized that this was animated. We really should be looking at the loop of Henle. The furosemide prevents sodium from being reabsorbed. So instead, sodium stays in the loop of Henle, and water will stay there too. Water wants to follow sodium. So if sodium stays in the nephron, by golly, so will the water. And that results in more water in the urine. And that's why this is called a diuretic. Coffee is a diuretic. Beer is a diuretic. So is furosemide. The danger is that these patients are losing electrolytes, sodium and potassium. So we do want to watch for signs of weakness. We want to do blood work to monitor their electrolyte levels. And then the final thing we'll talk about before we take a break is this other drug, Plavix. But before we talk about that, let's explain why a cat would need Plavix. So Killer has this hypertrophic cardiomyopathy, but any type of heart disease in a cat creates turbulence. It's not this normal heart anymore, and turbulence of blood will activate a clot. That's one of the things that tells the body there's something wrong, is turbulence from a cut in your skin or whatever. So turbulence activates the clotting cascade. Turbulence activates hemostasis, but it's forming a clot in your circulatory system. We call that blood clot a thrombus that, when it forms in a vein, but a thromboembolus refers to a blood clot that's obstructing a blood vessel. And here shows the heart. There's this blood clot is going to form, traveling down the aorta, and it's going to get lodged right here at the bifurcation of the aorta, where it goes to the iliac arteries that supply the feet. They call it a saddle thrombus sometimes because that's, if you were to put a saddle on a cat, that's where it would go, I guess. Well, I don't know if any of you have seen these cats. I know some of you have. It's horrible. These cats, you can hear them screaming all throughout the hospital. The pain in their back legs is unimaginable. They've got reduced blood flow to their legs, so they tend to have cold, sometimes cyanotic feet. I mean, they look blue. You check for a femoral pulse and you can't feel one. The prognosis is poor in these cats because you can't just go in and dissolve that saddle thrombus. We use Plavix to prevent this from happening. We used to use aspirin, as a blood thinner. So that's why we're using Plavix. It's basically a blood thinner. It's going to interfere with hemostasis. I can't remember how Plavix works exactly. I don't really care, but it's more effective than aspirin. It probably interferes with platelets somehow. The non-proprietary name is clopidogrel. But again, you can think of it as probably being something like aspirin. It's known to be more effective. Okay, so we'll take a break. Just to review, we learned that clinical signs and history can often help us to rule in or rule out certain disorders. Clinical signs to look for would be wheezes, orthopnea. Oh my gosh, this is full of typographical errors. Different kinds of coughs that are not coughs, but or coughs that are coughs that the owner thought was vomiting. Dyspneic cats and dogs must be handled with great care. Wait on radiographs until they're stabilized. Thoracocentesis is both diagnostic and therapeutic. Here's thoracocentesis in a horse. It's like a bucket of liquid obtained. Coupage is kind of fun and makes your patient feel good. Heart diseases can be myocardial or valvular, and they can be primary or secondary. And it's helpful to remember that certain breeds are at risk for certain primary diseases, the Maine Coon cat and hypertrophic cardiomyopathy, the King Charles Cavalier Spaniel, and valvular disease. We use furosemide as a diuretic because it promotes the loss of sodium in urine, but it can cause the loss of other electrolytes. And the same medication that people take to reduce the risk of strokes in them can help cats at risk for strokes. Okay, so maybe take a little break, and when we come back in part 2, we will learn about schmoogly.